To sum up, why is telemedicine only integrated in the minority of the heart failure patients and in the minority of the hospitals? First of all, there is a triangular relationship between the organization as well as the hospital and the healthcare professionals, the telemedicine system, which is also the supplier, and the patient with the relatives. And there are four main themes we discussed in this presentation. First of all, there's clarity and responsibility. Is there a shared responsibility, or is it the patient who is responsible for his or her own healthcare? Or is it the healthcare professional who is responsible, like the nurse who gives care via the telemedicine tool? And also, is then the nurse responsible when the patient is not cannot use the system in a correct way? Then, as a next important part, is who is liable when things went wrong. There are no legislation at this moment, and therefore there's a decrease of feelings in confidence in using and the safety of this system. The third thing we also discussed is that the infrastructure isn't ready yet. Patients in the hospitals can use the telemedicine, but when these patients transfer to their home setting, they cannot use the telemedicine anymore at a GP setting. And the third part is there is a lack of smart systems incorporated in the telemedicine. Therefore, the telemedicine isn't personalized at this moment, and therefore suboptimal. But we also know that the telemedicine has a lot of potential when it is developed. There are only 3 prerequisites for optimal implementation or integration and the use of telemedicine. And the first one is there should be structured care pathways between all healthcare settings, so like the hospitals and the GP settings. The second point is there should be more collaboration between the software developers, the patient, and the healthcare sector. And the third point, there should be more clarity between what is whose responsibility for what. So, to conclude, telemedicine is a way to deal with the 1 out of 4 persons who should work in the healthcare sector in 2040. Therefore, we should embrace this intervention and develop it and bring it to a higher level with much more potential for all of these 3 parties. Thank you for listening.